Hello and welcome to the Community Voice. I'm Fara Sax. I'd like to take a quick time to shout out to my stylist, Julian Chang, jewelry by Gina Z, which is located in Pinecrest. It's a beautiful boutique for all your wardrobe and accessory needs. My guests are 5 remarkable Miami-based healthcare practitioners. There's a pediatrician, a psychologist, a physical therapist, a nutritionist, and a family therapist who have created a network of care with one shared purpose: supporting children and empowering the families who love them. Their mission statement: 5 women, 1 shared mission, stronger, healthier families. We'll kick off things with 2 of the practitioners, and 2 others will join in the second half of this interview show. Thank you so much for joining me. We have Dr. Taryn Dubin. She is a pediatrician with Sunset Pediatrics, and Amanda Witherspoon. She is a pediatric physical therapist with Making Strides Pediatric Therapy. Thank you both for joining me today.
Thank you for having us.
So this is an amazing collaboration for 5 women that have come together in a community. How did all this start, Dr. Taryn?
So yes, the idea for this article feature was really born through conversations with members of this group, the women that you see here today, about how important collaboration is when approaching a patient and their family. I really believe that a comprehensive approach is important when looking at a patient, looking at not only just their physical health, but their mental health, looking at therapeutics, looking at their nutrition, looking at all those different things together is really the best way to approach a patient. And I say this a lot, but medicine really is best done as a team sport. So the times when we can get together and work together and collaborate on these patients, I really feel leads to the best outcomes for our patients and their families.
So you are defining this as a village of care. What does that phrase mean to you, both of you, in the context of family health care, especially here in Miami, which is such a diverse cultural pool of people?
Definitely. So I think, the village is really everybody that's involved, and the family's at the center of that village, right? I think that's the most important piece, is that the professionals were here to support the family and kind of create that village around them, but truly we have to kind of meet people where they're at. And so if, we have to acknowledge cultural, as you said, aspects. We have to acknowledge, caregiver roles. Every family looks a little different. Are there nannies involved that we have to educate? Are there, the teacher, is that part of this whole child approach? And so I think just looking at, as Taryn said, the whole child and the family and kind of working together as a team, it really does make a big difference.
And you didn't grow up here.
No.
You grew up in California.
Yes.
And you grew up in Miami. Yes. And you shared with us, you were a positive person of Pinecrest.
I was.
Oh, my God. And this is your second time coming back to us. Wow. You from a teenager to now.
Yes, it's an honor. I love Pinecrest, and I love, I grew up there, and so that's really my home. It's my bubble, and now my children go to school, in the public school system in Pinecrest, and it's really a special place. And there's a lot of community, and there's a lot of network, and actually the way that I met Taryn was through her husband, who also went to Palmetto High School with me. So, it's really neat, like the inner workings of the network in Miami.
And I love the fact that you came together, Dr. Dubin. It's so important, I guess, for a community, like you were saying earlier, to work together for the benefit of not only the children, but the families that love these children. And talk about why this was important, this mission for you.
Yeah, really just thinking about, village is the perfect world for it. There's obviously, working off the saying, it takes a village. And, I maybe even before I was a mom thought that was a little bit corny. I'm like, but now, like, being a mom of 2 young children, I really feel like that's so true. And I know what that means, looking at the parents and the teachers and other helpers that may be in the family. And I feel very fortunate as the pediatrician if I can be a part of that village for the patient and their family and build that relationship over time from seeing them as a newborn in the hospital when they're born, as they go through childhood. And I haven't been practicing long enough to see someone all through that, journey, but I get to see patients at all different ages and stages, as they say, of their life. And that is just really rewarding for me.
Tell me a little bit about the group that you belong to at Sunset Pediatrics, and what do you see there? How old are these babies? Is it babies, the teenagers? Then you send them off to big girl and boy doctors?
Yeah, so I would say the beginning, when we start, is very easy. We actually start with our families ideally before the baby is even born, and we do prenatal consultations. So that's really nice. A family knows I'm expecting a child. I need to find a doctor for that child. Ideally, they do that before they have a baby, and I think a lot of people are really good about doing with, how easy it is to find things online and in the newspaper and magazines, researching ahead of time. And then we come in and we talk about our practice and meet the family before the baby's even born. And then I'm fortunate to be able to go to the hospital and see the newborns right when they're born. We go to a few different hospitals and then see them in the office. And as they go through infancy, toddlerhood, into adolescence, and up through college is really when we see our patients.
And Amanda, tell me a little bit about what you do as a physical therapist and the practice that you belong to.
So Making Strides is a practice that I was the founder of. And so basically it's a concierge care model where I provide therapy directly in the home of the patient. And so I'm able to kind of spend more time with the patient, spend more time with the family. For physical therapy, I usually see my niche right now is newborns to 3 years old. So that's really my passion. I love early intervention. I think it's so important, so valuable, and makes a big difference in long-term outcomes. And so I'm able to go into the home and, see patients there, educate the family, make sure that everyone's kind of following through with home programs, and kind of really be a big part of, their everyday, kind of making sure that their everyday routines are going to optimize their movement. And
so you go to the homes. This is a home base, so
Yes.
people would call you, and then you would go. And what do you see? What kind of what do you treat, and how is it delayed? Is it just sometimes delayed motor skills, or what goes on? Tell me a little bit more about that in more depth.
So I a lot of times I get a referral that's just a newborn with developmental delay because the baby's not rolling and is 7 months old, or is not crawling and is 12 months old, not walking. And so I'll go and I'll do an assessment, and there's always a why behind why a child isn't doing something, right? And a lot of times there's they have low muscle tone, or it could be something just minor and they just need a little bit of guidance. So, and so I usually see patients twice a week, 45 minutes, and then I'll provide a home program and kind of something for the caregivers to follow through with as far as, exercises and things for strengthening to kind of promote optimal outcomes and movement patterns for the child.
So why did you decide to do this collaboration?
Really to show, our community that, they have a community of support, and that, I think the main message we want to get across is that, it's medicine is best done taking a comprehensive, looking at the whole person approach versus all of us working in isolation. So really, I don't only work with my pediatrician, but I can work with a nutritionist, I can work with a psychologist, I can work with a physical therapist. And not only that, but they can all work together as my team to support me through my health journey.
And what does that mean to you, Amanda? And how has that worked, the five of you coming together and referring, bouncing off ideas? Tell me a little bit more about that, how that relationship has solidified over time now.
I mean, it makes a big difference in the patient's care. Just knowing, my physical therapist is in communication with my pediatrician, is in communication with, my child psychologist, and it kind of is the glue that brings all of the little pieces. The parent's nervous about, my baby's not crawling and is not exploring new things, and then I just think that the kind of being able to communicate all of the professionals together as one unit really makes a difference in patient care.
couple of seconds we have time left. Closing statement between the three of us until I go to the rest of your team, which I know our audience would love to meet as well.
So I really think, when you have the right people on your side, you, as a parent, feel empowered to really, help your child thrive. And I really think parents always know what's best for their kids. And, we really, I think all collectively feel like that, is that when, you feel empowered as a parent and you feel like you have the tools to help your child, even if they're struggling in some way, it really kind of optimizes their outcomes.
Yeah. I think, one of the things I was thinking about as I was driving over here was how helpful this kind of team-based approach can help with being proactive about someone's health and, saying, okay, maybe we're picking up something and someone comes to me and says, oh, my toddler's having a little bit of a behavioral issue. Rather than say, let's watch and give it time, say, hey, I have a great psychologist. How would you feel about me connecting you with her and giving you that support before you're in extremis and in a crisis and you're being reactive to a problem? So I think having this network of, this is a representation of, our little network that we created, but a greater network of medical professionals really just helps get patients the support they need, and having the idea that as the pediatrician, the patient isn't best served by me handling everything, but by building a team for the patient that supports their individual needs.
Thank you. I want to thank you for the time, and please stay with us. We are going to continue this conversation with the mental health component of creating a beautiful, healthy community. We're back with the mental health portion of the team. Here with me today, Dr. Emily Wald is a pediatric psychologist with behavioral health services, and Dr. Elissa Martinez, clinical family therapist. Thank you so much for joining me. And like I said earlier, this is my favorite part of the show here.
I mean, we love talking mental health, so you're in good company.
It's such a hot button because without it, we got nothing. Besides our health, our mental health is so important. Talk a little bit about what each of you do in your professions and what we can learn today with the network that you are joined with, and how you're helping each other support the children and families in our community.
Sure, I can go first. So as a licensed marriage and family therapist, the way I basically view the world, with my therapy hat on, my parent hat on, my partner hat on, I think of us as being a part of a system. My problems don't exist in a bubble that I'm just, by myself. And so when I think of helping individuals, it's really about connecting the parents to the child and vice versa, and utilizing the help of individuals like Emily, who have different areas of specialty and work with kiddos younger than the ones that I work with, in supporting the entire family system. So if there's a teenager, for example, that I'm seeing for an eating disorder, or even supporting the parents through the journey of the recovery process, Emily can be seeing another one of the family members, and coordinating with pediatrician, dietitian, et cetera, is very much a part of what's ingrained in my work. I don't feel like I can do what I do on my own, whether that's thinking about the family and or the other providers that my clients are working with.
And Dr. Wald, what are some of the shifts that you've seen in how families view pediatric psychology and mental health, and some of its stigmas? How do you work with your patients?
I actually think it's been a very positive shift. I think that it's become a lot more normalized to have a psychologist, to have a therapist who's a part of your care team. And it's been really, really nice. As a matter of fact, I feel like more parents, whether that's moms and dads, caregivers, nannies, are involved in the child's care. And so with the access of telehealth, it's really nice because I can work with the child or teenager individually, but I can also see the parents, whether that's the mom, dad, caregiver, separately behind the scenes. And that can, to help teach them strategies to essentially reach different goals. Mm-hmm. So in general, I think it's helped the entire family work together and collaborate and reach out earlier. So as, Dr. Dubin was saying, we can be more proactive. So for noticing, a potential behavior or undesirable outcome, we can address it earlier.
And how old are the children, the families that you work with?
How what?
How old?
So it ranges. I mean, I have toddlers, they could be 3 or 4. And when it's 3 or 4-year-olds, I would say it's more parent training and giving them strategies to help shift dynamics and give them more control over what's going on, reduce outbursts and things like that. But I also have children in elementary school, middle school, high school, college, and postgrads. So now I'm working with, 22-year-olds who recently graduated and are looking for different jobs and navigating that industry.
Dr. Martinez, what are some of the things that are coming up currently that you're seeing that families should be aware of, whether behavioral changes or, we had COVID, and during COVID, there was one set of emotional, psychological problems that were coming up, difficulties on navigating. Where are we now, post-COVID 2025?
So how much time do we have? Because I have a lot to say about this. So one of the things that's been coming up a lot in my world is understanding AI and chatbots and all of the different things that are out there in the world that children have access to, and understanding how to set bounds and limitations, and also normalizing coming to parents or a trusted caregiver therapist when they're seeing something out there in the wild, wild west that makes them feel uncomfortable. Most of my practice focuses on eating disorders and trauma. And when it comes to disordered eating, body image, and kind of all the themes that influence the development of an eating disorder, learning how to appropriately know how to engage in social media, have social media competency as a parent is incredibly important. There is a trend of children going onto the internet and using chatbots as a therapist or a psychologist. And so being able to support parents in moderating and knowing what their child is seeing has been something that I've seen that's really important for us to manage. And there is a trend from pre-COVID times to when I was working in higher levels of care, so treatment 24/7 for children and adolescents with eating disorders, to having no technology, to recognizing technology is a necessary evil, if you will. There are positives of using certain apps and, having resources online, but navigating appropriate use rather than abstinence.
And what is that like now, having the network of the doctors that were on in the previous segment, and the work that you're doing together? How has that shifted, changed, opened your eyes, helped the community more by being in partnership with each other?
I have an example I can think of. Dr. Dubin and I were talking about something that was impacting children with eating disorders, and she was talking about the latest research that she's seen in her corner of medicine that is aligned with what I'm seeing, and being able to bring in different thoughts and experiences and join together toward the betterment of our patients in general, and then also for anyone that we're collaborating with, I think is really helpful. And just having other professionals who are moms as well, who have to balance and juggle all of the things, as well as have outlets to process and even vent sometimes. The challenges of owning businesses and dealing with the long hours. I think it's all incredibly important, both that professional, medical side, but then also the work-life balance piece.
And each of you really have a guiding principle. How do you hope these mantras really help parents, support their day-to-day? Dr. Wald, I'll start with you.
Yeah, of course. I mean, I want in general for parents and for families to know that even in the toughest moments, that change is possible. We are here as a team to help support you. And so that means working with people like Dr. Elissa and Dr. Dubin and really the whole team of helping to make sure they have the right support. So whether they're having anxiety or depression or different symptoms that they're experiencing, change is possible. I will see children or adolescents who have pretty severe OCD symptoms, and it can be debilitating at times. But just to feel empowered that they can learn evidence-based strategies that can lead to positive changes where they feel like they're regaining control over their lives. And the parents are seeing that too.
You both grew up here.
Yes.
Absolutely.
Where'd you go to high school?
I went to Palmetto High.
And Dr. Wald?
I did too, actually. I went to Coral Reef and Palmetto.
So you were friends before this?
we knew of each other, and it really is a small world of the women, and we've known each other since 5 years old-ish and on. It's kind of wild. You know, my mom always said that we were a really special cohort of kids, and I was like, okay, Mom, roll my eyes. But when you see what we're doing now, coming back to our community, it is really special.
And the reason I bring that up is because you, as high school kids, college kids, the things that you navigated.
It's so different.
So different.
It's amazing with the technologies. You were talking about the AI space, and how does that affect the work that you're doing and the relatabilities, considering it's completely different than what you were doing and what you were facing when you were younger?
Well, I think it's helpful that we have our own lived experiences. We have differences, but also that's why I think, each child and the client they're the expert. So hearing from them, getting to know them, what's going on. I mean, I think social media has contributed to great things, but also tends to increase more bullying. And I've seen it at a younger age where children are it's like 10 years old is kind of the new 14. And so helping to educate children and parents of, safe behaviors and how do we handle bullying or posting a picture, like challenges with messages and how it can be shared permanently with everybody. So what might seem innocent can actually be really harmful. And so I think just providing psychoeducation to help navigate, what comes along with technology.
And I think Dr. Dubin and Amanda probably see this in their profession. They're not here to speak to address this right now, but in pediatrics, they see all kinds of things. And that trickles down to you in this network where you can really do something to help these children, whether it be the ones that are in the physical therapy that are, they're different. They're deemed as different. And what happens in the bullying arena, I'm sure that you've dealt with that in your profession as well, right, Dr. Martinez?
Oh, yeah, absolutely. And in thinking of how to navigate these pieces, it really is about getting to having the patient feel empowered and understanding that you're there for them, whether that is them teaching you something. So when I think about the family being the expert, there's nothing more fun for a kid or a teenager, or even an adult, to teach me something and to make them feel empowered even in that space. So even if there's chaos going on, whether it's in the home, parental discord or bullying at school or cyberbullying, being able to have that safe space despite all the noise going on promotes an empowerment that they can then translate into the real world.
And last question is, in the 15 seconds, please, each of you, talk about that network that you have created, both of you.
So, when I think of the work that we do, we're always giving and helping others, and being able to have a support network and not just rely on myself and know that, kind of 101 training in grad school is rule out medical for us, right?
Absolutely.
And so being able to go out there and know that who I'm referring to and who I'm supporting, I really trust, makes a huge difference, because there can be so much medical trauma that can go on if you don't have a good experience, especially coming from a trauma-informed lens. It's critical that I trust the providers I'm sharing my patients with.
Dr. Wald?
No, I completely agree. I think working closely with a pediatrician, with psychiatry, with eating disorder specialists, with everybody is such an important aspect for gaining the desired outcomes. Like, I want to empower families, but it's a whole person approach. It's really not just one single thing. Anxiety can impact us mentally and physically.
I could talk all day. Yeah. Thank you so much.
I told you we could. Thank you.
Thank you. We'll be right back with the last portion of this, dietitian. We are back and going to learn all about nutrition as prevention. Part of the Fabulous Five is Monica Auslander. She is a family dietitian with Essence Nutrition. Welcome.
Thank you, Farah. Thank you for having me.
It's too bad you're not in the studio, but hey, life happens, right?
I know, it keeps happening. It's like this pattern.
But
everybody has to eat.
That's right. Everybody needs to eat. And it's really an important part of what we were talking. We were talking about physical, mental health, and now the nutritional component. And talk about that and how important that is, and also how important the network is to the work that you're doing and the collaboration of community.
Sure. So when I started as a dietitian, I worked in a hospital, and I was very used to having a multidisciplinary team. There were physicians, pharmacists, psychologists, social workers, physical therapists, occupational therapists, essentially everyone I've kind of stacked on the outpatient roster now. But that's really how it should be in outpatient. And it's kind of sad that you have to be in an inpatient hospital setting to get that kind of collaboration. Um, Nutrition is a very important part of what we would call, the sphere of health. It's not the most important. If we're talking like, in terms of a pie, it is a very important piece of the pie. Nobody wants to be missing any part of their pie. I find that nutrition is a very powerful mediator of health. I don't particularly like when people say that food is medicine, because medicine is medicine, but food is medicinal. So without the
That's
nutrition
very,
and
very
food,
interesting. That's very interesting approach, because I never thought of it that way. Because they
yeah,
always teach you food is medicine.
but it's not. Medicine is medicine. And I get that it's a metaphorical figure of speech, but to me, it kind of offends like Dr. Dubin. Like, she's medicine, I'm food, but food is medicinal. So, that I operate still under this very, very deep multidisciplinary approach with my like-minded practitioners. When I'm treating a person, I speak to them very, very often about the plan of care, and it takes into account not just, okay, here's the food prescription and everybody has to be quiet and just do it. Nutrition care is as much psychological care as it is physical therapy care, as it is medical care. And it's really, you can't have one without the other, but somehow healthcare does.
And how does this network work with your component of the nutritional aspect, with a pediatrician, with a physical therapist, with a mental health practitioner that our audience has met?
Sure. I'll give you an example that's, happening more and more. A child gets diagnosed with a chronic disease, whether it's type 1 diabetes or an autoimmune disease or something like a gastrointestinal disease. And there's, at the forefront, the medical professionals in charge of the diagnosis, right? Like, and they're in charge of the
Mhm.
pharmaceutical care and the medical care that this child is receiving. I come in and speak with the parents, the families, siblings, anyone responsible for the care of the child about the food landscape and what's realistic, what's affordable, what's culturally appropriate. How are we going to procure the food and integrate choices of foods into the whole family structure? And a new diagnosis of anything is very scary, even if you're not a child. So for a child, it's very, very terrifying. So we have to enlist a psychologist a lot to help the child and or the family come to terms and cope with a lifelong diagnosis. And, typically it involves movement of the body, because nutrition and physical movement are very closely intertwined. So we would have someone like, Amanda coming in there and with the physical movement piece. And then all of us are keeping in constant touch to kind of update each other on what's happening with the child and the family and the dynamics. And that's how we have what we all want, principally, is the best care outcome for the child.
And that's what it's really about, is how do parents make good choices? What a parent might think is a benign food comes in a bag, comes in a wrapper. It's something that could be very, very harmful to the child if there's an allergy, a food additive. Talk about how you educate families so that they are making good choices, best choices for their child.
Right. So many people assume that working with a dietitian means she's going to tell me what to do. And that's kind of part of the educational didactic piece, but you're going to be much better positioned in the long term if I teach you the language of how to make these choices and how to read labels and what they mean and what these additives or allergens or what have you, what they can do. And whether or not, if we're talking about, like an ultra processed food, right? Like, let's talk about Thanksgiving. Okay. Pie, right? I already mentioned pie. So
Yum!
yeah, I know,
Yum!
right? So let's say that a child has had no allergies and doesn't have any diabetes or medical conditions, and we're just talking about pie as pie. So I'm not coming in and saying, don't eat pie. It has sugar. Sugar is bad for you. Therefore, pie is bad. Never eat pie. I'm educating a family and a child, depending on their age and ability and, how advanced and they are and involved in their own healthcare. What's in a pie? How do we make it? How does it get to your plate? How does it get processed? And how can we maybe fit in a pie into a healthy relationship with food and a healthy food landscape over time? Would you like to make your own pie? If you are going to buy pie or choose pie, how much do you have? How do you pair it? What do you have throughout the day? Do you have other things? So how do we contextualize the pie? So much of what I do with food is not eat this, not that. It's intention and framework regarding the food.
And when dealing with a pediatrician, I'm sure pediatricians, the ones that you work with, Dr. Dubin, for example, they're finicky eaters. These kids are finicky. They don't want to eat. How do you coach a parent to say?
Believe it or not, the adults are worse. Because I work with adults too, and adult picky eaters are really a special breed. I do a lot of.
Tell me more. It's just us two now.
God, it's like, you have a grown person and you're like, okay, so I know you didn't grow up eating seafood or fish, but let me present you with why I feel like it's really important to include in your diet. Nope, not going to try it. I'm like, but
that's interesting because that's passed down to these children that become,
right.
I don't eat it. I'm finicky.
Yeah,
I don't like it. My father doesn't eat it. My father doesn't like it.
It's so important. You realize when you become a dietitian or at some point in your life, like, wow, I don't like these foods, or I don't think I like them, or I have some kind of bias to these foods because I never ate them growing up, or it's not in my culture, it's not in my region, or it wasn't safe, or it wasn't affordable. And how do I bring that bias to my children or not? In terms of, what we'll call selective eating, there's a whole spectrum of when it's behavioral and then creeps into pathological. The pathological side of if there's a sensory issue or some kind of ARFID, which is this whole other disorder that's really hot to trot now, that is rarer for me to see. Typically, I see what is completely normal developmentally. So I always have to reassure parents, like, yes, there's that one kid in class eating the cucumbers raw and like having themselves a time. That's my kid, just saying.
That's
and
me.
Then thank you. And then there's most of the children who are like, no, it's green and it's not sweet. Why would I eat it? So, it's completely normal for children to be selective and to have preferences. And these preferences are partly conditioned, partly innate. And my whole thing is, how do Taryn and I communicate to make sure that the child is optimizing growth and development? Okay. If they don't eat 14 vegetables a day, like, it's fine.
Is that okay? Is that okay?
Yes.
Do they eventually learn
Yes. Not everybody, but people grow up sometimes. So to me, it's like the lowest level of acceptability. Like, does your child eat at least 4 fruits or at least 3 vegetables? Do they eat these kinds of whole grains? They don't have to eat everything. And then I work with parents very closely on how to present and frame new or scary or novel foods alongside foods that are already comfortable. This is like we go very deep into this, how to mediate, we'll say, selective eating. I don't like to say overcome or cure it because that's not realistic, or that's kind of stigmatizing. But if I can get a kid that goes from breakfast of muffin to, maybe some derivative of a healthier muffin and some yogurt and blueberries, like, case closed.
Mission accomplished.
Right? Yeah, I don't care if the yogurt is even sweetened, like we're not going for the gold here. We're going for improvement. I always say progress, not perfection. So
absolutely.
I do like to take pressure off of parents in that way.
Absolutely. And talk about, in a couple of minutes that we have left, talk about what the network, how that's benefited the pediatrics division, the physical therapy, the mental health, the component of that, married with the nutritional component that you bring to the table in the network that you've created with these wonderful dynamic women. Congratulations.
Thank you. I couldn't have done it alone. It's just made it so, I don't want to say easy, like our work is not necessarily easy, but it's made it so much more efficient to get good healthcare and to have better care outcomes. Because if it's just me in my private practice, here in the digital cybersphere world, great, I'm giving you all the tools you need, but then it's on you to get your own physical therapist, pediatrician, psychologist. But bringing everything kind of in-house to a very close team who I can call Amanda day or night, she doesn't sleep, and be like, hey, how is this patient doing? What do you think of this, and this, and this? Like, it's just such better coordination of care, and the healthcare outcomes are so much better. And the practitioners have an easier time. The parents have an easier time. One of my patients yesterday who I share with this particular team said, it's so nice to have people thinking about my child and in ways that don't occur to me when like I'm sleeping, and I'm like, yes, we're very full service here. Like we are literally always thinking like, how can we do the best thing for this child? And you as the caregiver are just responsible for giving the care.
You do great work. Thank you so much for this time, Monica. Have a great day.
Thank you, too.
I just wanted to thank you for taking the time to enjoying this beautiful interview. And you want more information, it's underneath each of their names. And I want to thank you for joining me. I'm Fara Sax. Until next time, take care of yourselves and each other. Have a great day.